Thanks for hitting play on the Behavioral Health Matters podcast with Magellan Behavioral Health of Pennsylvania. I'm John Lees, your host and the Lehigh Valley member and family advocate. This is the show where we amplify positive mental health, demystify behavioral health services, and work together to eliminate the stigma. Let's dive into today's conversation. On this episode, we're discussing the delivery of behavioral health care within rural communities and exploring the lessons, goals, and strategies behind coordinating care for HealthChoices members of all ages. Our special guests for this episode are Cathy Krinjeck, HealthChoices Executive Director and Director of Behavioral Health Services of Somerset and Bedford counties, and Dr. Feffick, Chief Outcomes Officer at Nulton Diagnostic and Treatment Center. And a quick reminder, remember to stay tuned to the end of the show to learn how you can send us your feedback and suggest topics for future episodes. This podcast is for informational purposes only and does not constitute medical or clinical advice. Individuals should consult their provider for care decisions. And now here's my conversation with Cathy Krinjeck and Dr. Feffick. Hello, Cathy and Dr. Feffick. Welcome, and thank you so much for joining us for this episode. If you would, could you provide the listeners with a little bit about your backgrounds and maybe a short summary of your current roles and responsibilities?
Sure, I'd be glad to. Hello. Thank you so much for having me today. My background has been in behavioral health for many years, and I'm not going to say how many. I've worked in a variety of settings, including mental health and substance use day treatment programs for children and adolescents that were adjudicated delinquent or dependent. I also served as the director of a large outpatient psychiatric clinic that spanned, several counties, and the director of a residential treatment facility for children and adolescents. So I've been around the mental health world for a while. Since 2019, I've worked exclusively in Somerset and Bedford counties. First, I started as a deputy administrator for the county behavioral health system. And since 2022, I've been the executive director for behavioral health services of Somerset and Bedford counties. In my current role, I kind of oversee the management of the HealthChoices behavioral health program, which includes the medical assistance behavioral health contract with the state. Now, while physical health services are managed separately, our responsibility is ensuring that, members enrolled in medical assistance have access to high-quality behavioral health and substance use services. Now, I also oversee the contract between the counties and our behavioral health managed care organization, monitor the provider network to ensure members have access to quality care and that they have adequate services that are available for their needs. So work very closely with the provider network, community partners, state and local agencies, to strengthen Somerset and Bedford counties' behavioral health services.
That's great. And Dr. Feffick, how about your background and your current role and responsibilities?
John, thank you so much for having us. My name is Dr. Feffick. My background is in the social services and the behavioral and mental health field. I obtained my PhD in community engagement from Point Park University in Pittsburgh, Pennsylvania. And originally being from the Cambria County area, I moved back to Cambria County in 2021 and have worked at Nulton Diagnostic and Treatment Center ever since, having various titles from supervisor of our community-based intensive treatment or CBIT model to now our Chief Outcomes Officer. Nulton Diagnostic and Treatment Center works across the state to provide behavioral and mental health services to individuals in more than 12 counties, including Bedford and Somerset. Within my current role, I actually have a strong focus on data-driven decision-making, program development, and strategic growth within behavioral and mental health services.
All right. Very glad to have you both as we talk about behavioral health and healthcare overall in rural areas. And so we'll get things started now, and we'll start, Cathy, first with you. If you could briefly describe the role of the BHSS-BC care management team in Somerset and Bedford counties and how your work supports rural health, particularly through coordination of physical, behavioral, and maternity care.
Oh, sure. I'd be glad to. I think one of BHSS-BC's greatest strengths is our clinical care management team. The members we serve, they have very complex behavioral health or, substance use needs. And, they may be navigating multiple providers and services, and that can really be very overwhelming. Our care managers help make sure members receive the right care at the right time. Now, our team includes 4 clinical care managers and a clinical director, and they coordinate services for members who have complex, high risk, and high cost needs. Our care managers live and work in Somerset and Bedford counties, so they know the communities, they know the providers, and the local resources available for our members. Now, a unique part of our team is our maternal health care manager. That role supports pregnant and postpartum members. She works closely with both the behavioral health and physical health managed care organizations during the member's pregnancy and also after delivery. She connects members with behavioral health treatment, coordinates with medical providers, and addresses health-related social needs. Also, screenings are completed for many areas such as depression, anxiety, substance use disorders, trauma, and other health-related social needs. And these screenings are done during monthly outreach calls, and she monitors treatment engagement during these calls, assesses progress, and helps remove any barriers to care. Now, in addition to our BHSSBC's care management staff, Magellan also has 3 full-time care managers dedicated to serving members in Somerset and Bedford. These teams work together to ensure high-quality care and that the behavioral health needs are addressed to support recovery.
That's great. It sounds like there's a really strong and experienced team, which is wonderful. I'm sure it's an added benefit that they're from the area and know the resources in the community. And I really like how you frame the idea of folks getting the right care at the right time, and using a recovery lens and perspective on how you're supporting the needs that folks are presenting with. It also sounds like there's a good bit of complexity and a lot of different needs that people are presenting with, like behavioral health, medical care needs, maybe substance use. And I imagine there must be a lot of expertise and experience being applied by the team there when they're working with individuals.
Well, yes, absolutely. And just to give you an example, our team, you have to have you have to be like a licensed social worker, a licensed clinical social worker. So 3 of our care managers are licensed social workers, and 1 is a licensed clinical social worker. So yes, and they've had experience out in the provider world as well, working in different areas. And like I said, they just have those extra eyes on the members to assist them with any of their needs and to help, like I said, support their recovery.
Yeah, it seems like the landscape is really shifting, which is a good thing, from where we used to see things strictly as mental health or medical health, or a substance use issue, and recognizing that people are more complex and have more complex needs, and they may be dealing with issues related to a combination of these areas. So it could be mental health and physical health, or it could be mental health and substance use. And so I would imagine that the expertise and experience the team has is very helpful and beneficial in helping these individuals to get the right care at the right time.
That's correct. And you're looking at, specific criteria needs to be met for some of these people. They might have had 3 or more inpatient hospitalizations in the past year. Children and adolescents in out-of-home placements are automatically put on caseloads. Children and adolescents in multiple levels of service, families with several children in multiple levels of service, co-occurring, like you just said, behavioral health, physical health needs, discharge from state hospitals. I'm trying to think off the top of my head. Also recommendations by the county. If the county would call us and say, hey, we have a member that we're very concerned about and we think they need that extra case management, care management, then they go on to the services at DHSSBC.
That's great. And so shifting to you, Dr. Feffick, how does multidisciplinary care address high-quality care concerns, particularly for those individuals dealing with complex and high-acuity needs?
Multidisciplinary care is one of the most effective strategies we have of overcoming that fragmentation because it creates that shared accountability for outcomes and ensure that patients don't fall through the cracks between those systems of care. So for us, our community-based intensive treatment, or CBIT model, is a really good example of that coordination. It bridges the gap between the inpatient care units, outpatient care services, and then the community supports. This model was actually specifically designed for those high acuity folks, those who haven't been well serviced by the traditional outpatient models. We use multidisciplinary teams that include psychiatry, nursing, therapy, case management, and peer support. The caseloads are intentionally small, so the individuals receive focused, individualized attention, and then services are directly provided in the community, so in people's homes or their daily environments, which makes for more practical and relevant care.
Yeah, so it sounds like by using the CBIT model, you're able to see the total person, all of their different needs, and it sounds like by delivering those services in the person's natural environment, you're able to remove some of the potential obstacles or barriers, and have a greater impact on the person's ability to really fully benefit from the services. So it really sounds like the data is showing just how positive the approach has been.
Nailed it right on the head there, John. Essentially, we just have a team working collaboratively for the best outcomes of the individual.
And now, a brief word from Magellan. When you're caring for a child with autism, it can feel overwhelming trying to sort through all the different interventions, tools, and strategies out there. Magellan Healthcare's autism experts help make the process easier. They review and curate evidence-based resources designed to support everyday life and empower parents, families, and caregivers along the way. Through the Autism Marketplace, you can explore online and tech-enabled tools that support real-world challenges, like GPS safety solutions for children with special needs, mobile training that helps reduce challenging behaviors, and practical screeners and guides for developmental differences. To learn more, visit magellanhealthcare.com/autism-marketplace. That's magellanhealthcare.com/autism-marketplace. And now, back to the show. So if we could expand the conversation a little bit and talk about some benefits of technology the two of you have seen in Somerset and Bedford counties over the past couple of years. And Cathy, I'll start with you. From your perspective, how are you currently seeing telehealth used most effectively?
Sure. Telehealth, well, it became essential during COVID-19 pandemic, and it was born out of necessity, an important part of behavioral health care. Now, today, providers still use telehealth services, although it's a little bit of a drop than what we saw, of course, during COVID. But we're utilizing it, providers are utilizing it for medication management, individual therapy, case management, substance use disorder treatment. For many people, it just makes it easier to keep appointments, reducing that travel time and eliminating transportation barriers. But at the same time, we recognize that telehealth isn't always accessible for everyone. Somerset and Bedford counties include many rural areas where reliable high-speed internet is still a challenge. In those situations, some audio-only services may be appropriate when internet access isn't available, helping to make sure members still receive care. Now, we were happy to hear and encouraged by the state's investment in expanding broadband access across PA. Governor Shapiro announced funding, kind of expected to connect more than 130,000 homes to reliable internet. These improvements will take some time to implement. It's not going to happen overnight, but it's an important step toward improving access to telehealth and other essential services for people living in rural communities. So not quite at the level it was with, but we are seeing it. We still see, billing coming through for telehealth services, which is great.
Yeah, and I know, you mentioned, it really expanded during the pandemic to allow for that connection. We saw the same thing here in the Lehigh Valley where I'm situated. And so prior to that, it was used, but certainly not as widespread. And so it seems like what they're now really trying to do is to have it as an option, more widely available. And so to your point, I think the better the supporting technology and infrastructure in any area is certainly beneficial for those who would prefer to use it or might need to use it. And that's both for the clients who would be using it, but also for the provider agencies, I would imagine as well.
Absolutely. And also allows you, if you're utilizing a doctor that maybe this is setting right in Bedford and Somerset counties, really expands the ability to reach out and the shortage of psychiatrists. And also just to mention too, advanced practitioners, CRNPs and PAs are able to practice telehealth, which is a great help for this. They must follow regulatory guidelines, but they have a collaborative agreement with an MD, especially in these rural areas where transportation barriers are such an issue. Yeah.
Yeah, for sure. And I think, again, it really expanded and grew as a result of the pandemic. I think what was good from that, from my vantage point, was it was being widely used then out of necessity, and it allowed for a period of time for all folks involved, including the state and other monitoring agencies, to really figure out how do we best use this, establish best practices, like you mentioned. What are the regulations we need to now put into place to make sure folks' privacy is protected and so forth. So very glad to hear that it's, it can be used very effectively and successfully to help folks to connect with care that they need. Yeah. Dr. Feffick, in your team's efforts at Nulton, what role does the utilization of mobile services play in the delivery of quality care to your members?
Mobile services are increasingly critical to delivering those high-quality behavioral mental health care services because they truly help members and meet them where they are, both literally and figuratively, if you think about it. So many individuals face barriers or symptoms that make it difficult to attend traditional office-based appointments. So mobile services improve access by bringing care directly into the homes, schools, workplace, and essentially the community settings and environments of our clients. From a quality perspective, mobile services allow our providers to assess individuals in their real-life environments, which can actually lead to more comprehensive understanding of clients' needs, their strengths, overall their social determinants of health, often improves their engagement, supports earlier on in intervention, and truly helps reduce unnecessary ER visits, hospitalizations, and crisis where it escalates to a certain level. So for us, the mobile services also promote that continuity of care and strengthen relationships with members by offering more flexible, person-centered supports.
Yeah, it's interesting. So of the individuals who receive mobile services, would you say, or how many would you say, approximately are getting the service because it is absolutely necessary? In other words, they wouldn't be able to connect with services otherwise, versus those who, it may be something that's available and identified as something that they could use.
Really, that multidisciplinary team, we have a lot of community members that, based on different ailments, whether it be physical, mental, or behavioral, can really truly not leave their homes or their communities. So for us, really going into the communities and into the homes are providing real life treatment for these individuals so that maybe when a crisis situation or even a high anxiety situation arises, they're able to utilize tools in their own toolkit rather than leaving their communities, going to an inpatient or ER setting, and then having to build all those new resources. So going into the community and into the homes actually then are able to build and recommend treatment really that is person-centered and provides those really tailored outcomes, not only for clients, but MCOs and payers.
And so it's not just a transitional service, it's something that individuals can receive for as long as they need it or is necessary?
Oh, absolutely. It's all based on the needs of the client. So if the client would say need us for 6 months, we're there for 6 months. But hey, if they need us for a year or two, we're there too to support them.
And Cathy, from, we've talked a little bit about telehealth and the use of that, and now obviously mobile services. Are there other kind of countywide efforts that you can talk about in terms of what's being utilized by Somerset and Bedford to help the folks who are there and needing to receive services?
EHSSBC currently has 4 active reinvestment plans, and our key reinvestment effort is our crisis enhancement plan. We operate this plan, in partnership with Developmental Behavioral Health Services, DBHS, our county behavioral health program. Now, the main focus of this initiative is, of course, to reduce dependence on emergency departments and the criminal justice system for behavioral health crisis. The goal is to connect individuals to the least restrictive but most appropriate level of care. A major part of the work is also increasing public awareness, making sure people know where to turn when they're in a crisis. So to increase public awareness throughout Bedford and Somerset counties, 988 suicide and crisis lifeline billboards have been placed and rotated throughout the counties at various locations over the last almost 2 years. We also work to strengthen our mobile crisis response, and this is a big part of our mobile plan, our crisis plan. The crisis line is staffed by county personnel during the day, with evening, weekend, and holiday coverage provided through our subcontractor, Center for Community Resources, or CCR. We have 2-person teams, and part of those teams could be a certified peer specialist. So we did offer in September of 2025, we provided CPS training, and this training would empower individuals with lived experience to help in a professionally support others in recovery. Now, a major expansion occurred in October 25. We launched 2 24/7 mobile crisis vans, one in each county, and these were the first in the state. They were in other states such as Kansas, but nothing in Pennsylvania. So Pennsylvania, OMSAS are very interested in how our vans are working. These units will bring trauma-informed in-person crisis intervention directly into the community. They allow trained clinicians to respond on-site. They can de-escalate and stabilize, create that safe environment for individuals in crisis, while connecting them to ongoing treatment. We kind of meet them where they are. So in the first quarter of 26, the mobile crisis team, they responded to 138 dispatches. Since launch, we've also seen a stronger coordination with inpatient providers, increased collaboration with law enforcement and EMS, and we're happy to report, law enforcement has been directly contacting crisis services rather than immediately transporting individuals to the emergency department, which is one of our biggest goals. That's what we were striving to do, and it's happening. Overall, this initiative is helping to shift crisis response to a more community-based, trauma-informed approach that prioritizes safety and connection to care.
That's great. And I will disclose, mobile crisis is near and dear to my heart. It was one of the first jobs I had when I got out of graduate school years ago down outside of Philadelphia. And very challenging work, but certainly very rewarding. And what I took away from what you just said, that really, it sounds like the outcomes are it's really having a big impact, and that's great to hear. But also that there's this collaborative partnership, it sounds like, with law enforcement. That's fantastic as well, that folks are getting routed or connected with the right resource to really support them in a time of need and time of crisis.
Absolutely. And we always say, we all are doing great work. You have law enforcement, your school districts, your mental health providers, but we're kind of working in silos, and we're kind of trying to bridge that a little bit. So we're all kind of more collaborative front coming forward, and we're seeing some results from those collaborations. We're very excited with what's happening in Bedford and Somerset in those areas.
And now, a brief word from Magellan of Pennsylvania. We're here to support our members and their families. If you are a loved one or a Magellan of Pennsylvania member and need information about your services, please visit us online. Find answers and resources at www.magellanofpa.com. That's www.magellanofpa.com. And now, back to the show. So let's continue the conversation and highlight a few specific community-based topics which are top of mind on a daily basis. And Cathy, another question for you. I understand that the counties have been doing a lot of reinvestment work related to health-related social needs. And the question is, what challenges do you see that still exist? And where do you see collaborative opportunities, in particular with regard to homelessness and employment opportunities?
Yes. We currently contract with 2 community-based organizations, Center for Community Action in Bedford and Tableland Services Community Action in Somerset. Now, they assist members with health-related social needs, such as food insecurity, financial hardship, transportation barriers, utilities. Throughout Q1 2026, we had 191 lives assisted in Bedford and Somerset counties. And in 2025, 733 lives were assisted. So, I love hearing the stories like a woman trying to get her GED trying to get her GED diploma, but didn't have the funds to test. We were able to help her get the funds to test, and she successfully passed her GED, and we were so happy. Car repairs, trying to help people when they're, maybe they need something with their car to get back and forth to work or to appointments, and we're able to assist. Security deposits to secure housing. We get a lot of those requests. You have to have your deposits down to secure housing, and folks could use that extra hand to get that done. Utilities, electric, water, heat. We also have another interesting reinvestment plan. It's Priorities First Housing, and it's through PJ Works under the leadership of Dr. Peggy Hoffman. And it actually provides support for people moving into housing with skill development, budgeting, recovery, support, teaching people how to be responsible tenants. So when they first go into the program, they would assess them and say, okay, if they need behavioral health supports or physical health supports, assisting them getting their insurance. And then right away, they start working with them to start to work to get a job and to stay in the program. The goal was to foster independence, of course. In Q1, there's only 9 members, but it's small. It's starting out, and we're happy to say 3 were successful, 2 were unsuccessful, and 4 currently involved in the program. So those are some areas we're doing to try to address housing, and that's also a service initiative for ours moving forward to take a look at housing, kind of see what else we can do in that area.
That's really great. And again, at the top, we were talking about how we used to be very much operating in silos, and everybody kind of had their lane or the scope of what they would do with regard to their particular part of the system. But those additional supports and programs you referenced, while they might seem like they're managing more practical needs like housing and so forth, I would imagine that's a real benefit for someone who may also be experiencing, have a mental health diagnosis that they're trying to manage, or substance use issues. But these additional services and supports can really help by managing those practical needs. And then that allows them, I would imagine, to get the most out of the care that they might also need, as well as get identified for potential care needs.
Yes. And I think, too, just the connection with the CBOs, yes, you're absolutely right. And that just gets the, like I said, the eye on folks to see what other needs they might be experiencing.
Yeah, it's really seeing the total person, and acknowledging that we're not just defined by a diagnosis, whether it be mental health or otherwise, and identifying what those needs are and would be, and really just trying to get a full picture, and that would include what are some of the basic needs that may seem quite straightforward and simple, but we might be struggling with and maybe impacting, the quality of our life, certainly. And then once we can get some support around that, we would hopefully be able to get the most of any treatment, get identified for treatment, so we don't have that added stress. So it's really seeing that full picture and that total person, it sounds like, which is really great to hear. And so pivoting and shifting to you, Dr. Feffick, we had talked about transportation already, but we do know that transportation is often a frequent barrier for a patient to have access to quality care. And in particular, this can be challenging when public transportation isn't available. How is Nulton best able to meet members where they are when there is a transportation challenge that the individual is experiencing?
So travel is actually one of the biggest barriers we do see in our clients. In some cases, those individuals who would need to travel long distances just to access basic services tend to lead to missed appointments or even disengagements from care. So we had talked about before our mobile mental health and CBIT models, but also blended case management goes directly in the homes. And we use that in combination with our telehealth services to reduce unnecessary travel when appropriate. So this combination significantly improves the engagement of our clients, which we have seen within our attendance rates. So in the CBIT model, we look to secure individuals with a 7 and 30-day medication management appointment with a licensed psychiatrist. And this year, with the combination of telehealth and community-based services, in Bedford and Somerset counties, we saw a 100% show rate for that 7-day medication management appointment, and then a 95% show rate for the 30-day med management appointment. So really able to tackle that transportation barrier.
That's great. And again, it's such a key thing. As you said, it's the ability to really stay connected and remain connected in order to be able to get the care and treatment. And so if we as a system can tackle that obstacle, it sounds like a variety of potential options being used, whether it's telehealth or mobile or blended case management, really help folks to maximize their care, stay engaged, and really have the best quality of life.
Yes, we try to get as creative as we can on ensuring that individuals are connected to supports and can access us at any time.
That's fantastic and such a great approach. And again, it sounds like from the outcomes that folks are really benefiting from that. So that's wonderful to hear. And now, a brief word about 988. Life can get heavy, and sometimes it feels like you're carrying it all on your own. But you don't have to. If you or someone you know is struggling, help is just 3 digits away. Call or text 988 to reach the Suicide and Crisis Lifeline. It's free, confidential, and available 24/7. Whether it's a mental health crisis, emotional distress, or just a moment where you need someone to listen, 988 is there. You are not alone. Call or text 988 today. And now, back to the show. We turn to our final couple of questions for each of you. Our first one is around stigma and mental health and substance use, and we ask each of our guests this. But one of the reasons we started this podcast was to try to do our part, even a small part, to help reduce stigma through these conversations, and stigma specifically around mental health and substance use. So I'd be interested to get each of your perspectives on stigma and mental health and substance use. And based on your own experiences and perspectives, how we're doing with that? Are we overall reducing stigma? Is there continued work to be done? If so, what does that look like? And really just what's your take on stigma and mental health and substance use?
Hey, John, that's a really good question. I believe we've made strides in this area. Yeah, but there's still definitely work to do. I also believe that several, high-profile people, famous people coming forward discussing their mental health challenges has really helped in this area as well. We need to continue to work to encourage people. We're working to bring another tool into Somerset and Bedford counties, the Avidum clubs, into our school districts. These are peer-led, peer-driven clubs dedicated to reducing the stigma surrounding mental health, depression, and suicide. Now, these clubs have been very successful in other areas of the state. And I'm looking at the kids getting involved and the folks getting involved in the younger generation. I'm hopeful that the next generation is just not waiting for help, but they're actually creating a culture of support.
And Dr. Feffick, how about you?
But for me, I truly echo Cathy that I believe that we're making some really meaningful progress. Mental health is being discussed more openly than it was even 5 years ago. Public figures, healthcare organizations, employers, and schools are recognizing that mental health is a critical component of our overall health. And we've also seen greater acceptance of seeking treatment and more conversations about recovery from substance use disorders. However, I don't think we're finished yet, John. While awareness has still improved, stigma still influences whether people seek care, remain engaged in their treatment, or even feel comfortable talking about their mental health experiences. So for me, I think one of the most effective ways that we can continue to reduce that stigma is through educational. When we talk more about mental health and substance use disorders as treatable conditions, and when people are hearing more of those stories from their peers about recovery and resilience, we often shift that conversation more from that judgment perspective, more from an understanding and kind of helping each other out as neighbors.
Yeah, I totally agree with what you both said and shared. We've heard that from other guests as well, that we are making progress. A lot of it is a byproduct of, people sharing their own stories and being a little more comfortable to talk about mental health and substance use. It's also opportunities like this to help promote awareness around mental health and substance use, talk about the available resources that exist and how to connect with those. Help people to understand that mental health is no different than any other health condition and that there's treatment and support available. And if we're doing a small part to help others have their own conversations and move forward, then that's a good thing too. So we appreciate your perspectives on that. And as we shift to our final question, which is our one thing question that we'll ask each of you, we've obviously covered quite a bit of ground in talking about rural health, but if there was one thing you would want the listeners to now know, having listened to this episode, what would that be? And Cathy, we'll start with you. If there was one thing you'd want the listeners to know about rural health and have one takeaway, what would that be?
Yeah, I think to know there's a lot of good work going on in Somerset and Bedford counties, a lot of qualified, passionate people providing these services. Again, I think admitting you're struggling is the first step and realizing you are not alone. We need to look at mental health symptoms the same way we look at physical health symptoms and encourage folks to reach out and get the help they need. Schools, community providers, law enforcement, court systems, just to name some. So you don't have to do this alone. There are supports out there to help you. And I think that's what I'd like to leave it with, that there's a lot of folks out there willing to give you assistance.
That's a really great message for the listeners to hear. And Dr. Feffick, how about you? One thing you'd want folks to walk away now knowing?
For us as providers, talking today is not a competition. Whether we're in the rural community or an urban one, providers are strongest when we work collaboratively together. I've been very lucky to work with numerous community partners, including Cathy and her team, and we are truly the strongest and we accomplish the most to partner and work together with other providers. So by partnering together and focusing on the needs of the people we serve, we can build a more connected system of care and help more individuals access the care and support that they deserve and need.
And again, just another wonderful message. And this is just a perfect example of that. The opportunity to sit down with both of you and to learn from you, for you to be able to share the great work that's happening and to be able to tell this story. So we're really appreciative. We thank you very much for sitting down with us to tell this story. We enjoyed the conversation and learned a lot. And we wish each of you the best going forward. Thanks again.
Thank you so much.
And thank you so much for having us.
Stick around. We'll be right back to wrap things up. So what did we learn on this episode? Well, we learned that rural health transformation happens when care is local, mobile, and connected to community systems. When services are brought into the community, real-life barriers are addressed. Systems work together. We start to see care models that truly meet people where they are. And across Pennsylvania, care teams are already leading this work and building more responsive, connected systems of care in their communities every day. We'd like to thank our guests for this episode, Cathy Krinjeck and Dr. Annie Feffick, for joining us for this episode and for helping us to learn more about the delivery of behavioral health care in rural communities. We'd like to thank all of you for listening to this episode of the podcast, and we invite you back for our next episode. If you have any questions or feedback about the podcast, or have suggestions for future episodes, reach out to us at mbhofpa@magellanhealth.com. And if you enjoyed this episode, please help us grow by liking and subscribing. And remember, the Behavioral Health Matters podcast is now available on all major platforms, so you can listen wherever you find your favorite shows. Thank you for being part of our journey. Well, that's it for now. I'm your host, John Lee, saying goodbye for now, but please remember, behavioral health matters.